Greetings to all from Mrs.K.Jansi Rani, Assistant Professor of Nutrition and Dietetics, the Standard Fireworks Rajaratnam College for Women, Sivkasi. It's very nice and warm pleasing to meet you all online again after a very long time. Hope you all are safe and sound at home. So today we are going to discuss about food sensitivity. Immunological response to a specific substance. It shows characteristic symptoms whenever a food is ingested. It can further be defined as an altered reaction of a tissue for a foreign protein or an antigen being ingested to our body. It can be further defined as food hypersensitivity reaction, which means a hyperreaction caused whenever a food which is an allergic or antigen to our body, it's been ingested by us. There are two types of reactions usually happens in food allergy. The first one is immediate response. With the name itself we can understand it is the response which causes in fractions of seconds. It is immediate response is generally immunoglobulin E mediated response. It results from the interactions between allergen and target cells sensitized usually by immunoglobulin E. It releases histamine from mast cells and basophils and acts on blood vessels, smooth muscles and mucous glands on skin, especially in the respiratory and digestive tracts, which produces symptoms within minutes or hours of exposure of small quantity of allergen. This reaction may usually goes off within 20 to 48 hours, which is the symptoms and the allergic reaction usually will get disappeared within 1 or 2 days at the max. It is generally caused by protein present in the food. Any individual who are sensitive to egg and nuts experience immediate violent reaction whenever they are exposed to this even very small quantity of allergic food or food which are allergic to them. And then the next response type is delayed response. This is unlike the immediate response, this is cellular in nature, which means it does not circulate antibodies throughout the blood vessels. It is within the cell only. The symptoms appear in this type. The symptoms appear after 24 to 72 hours of ingestion, which may last for several days. This response is mostly caused by T cell mediated hypersensitivity, which is involved in some chronic immune mediated food intolerance. Example, some individual may have cow's milk protein sensitive enteropathy or celiac disease and so on. Next we are going to see about symptoms of food allergy. Food allergy can occur in any part of the body and the symptoms also can show in any part of our body. Whenever a person is incidentally or accidentally coming across with the food which is allergic to him, he may show systematic symptoms. Skin is the most predominant place where we can see many of the symptoms of food allergy. So first we are going to discuss about the symptoms of food allergy which are caused over the skin. Skin may get dermatitis, which is a common rashes, edema, the accumulation of fluids, and blisters may appear. Blisters is a tiny pocket of fluid between the upper layers of skin which may cause itching. Brutus is an unpleasant sensation of the skin that provokes the urge to scratch, and then urticaria is a normal itching and which is a swollen pale red pump, usually when we are exposed to a sting bite. These are the symptoms which are appeared in the skin when we are exposed to some of the food allergy. We are going to see about the symptoms which are caused in GI tract, that is gastrointestinal tract. The major symptoms which will cause in GI tract is abdominal pain, general pain in the stomach, and distension is a filling of air, a fluid, and causing blotting sensation, which is called as distension, and nausea and vomiting. You all know nausea is a sensation of vomiting, and vomiting, cramping, again pain, constipation, which is generally like infrequent bowel movements, or a difficult feel in passing of stools, diarrhea, as you all know, and dyspepsia is again another form of indigestion, and flatulence, as you all know, a bloating or air formation, generally a gas formation inside the stomach. Next, we are going to discuss about neurological symptoms. So, neurological symptoms include migraine, which is a headache in one side, neuralgia, which is a sharp and shocking pain that follows the path of a nerve, any nerve, and tension fatigue syndrome. It is a collective syndrome where the people can get more anxiety, and they will be tensed, or they will feel fatigueness or tiredness that doesn't go even after taking a lot of rest. These are the very difficult to believe. Due to ingestion of allergic food, a person may behave weird, he may become anxiety, and he may become tired and tensed. And then comes systematic syndrome, which is anaphylaxis. Anaphylaxis can generally, it is a potential life-threatening allergic reaction which may occur within seconds or minutes of exposure to something you are allergic to. It is similar to like sting bites or bee stings, like that. Cardiac arrhythmia, which is arrhythmic beating of heart, and then which may end up in hypotension, which is reduced blood pressure. Then comes the symptoms of respiratory tract. It is allergic asthma, bronchitis, a shortness of breath, maybe running nose, or nasal polyps, anything. And then we are going to see about the diagnosis method. So, how to diagnose that someone is allergic to a particular food. First thing to find out the allergic food is dietary history. Dietary history involves the careful history of patient's diet should be maintained in this system, and if rapid and immediate symptoms occur on ingestion of a particular food, patient can make on his own. But it is difficult to associate with the delayed response. That is, if you get delayed response by a food which you are really allergic to, it will be difficult for us to know to which particular food you are allergic to. Patient should record a food diary in which he has to mention all the food he has ingested with the disturbances or feelings he dealt with after the ingestion of a particular food. This is food diary. This is called as dietary diary, and by getting through the history of the food he ingested, we may come to know the particular food he is allergic to. Then provocative test. It is a clinical test in which a small portion of suspected food is given to the patient without his knowledge. Typical symptom should appear at appropriate time. This test will be repeated for minimum 3 times with proper intervals. So, in all the 3 times, if the patient shows characteristic symptoms to the particular food which is ingested or which is suspected to create allergy, and then we can confirm that the particular food is allergic to the patient. The disadvantage of this provocative test is it may end up being dangerous for patient who have severe allergic reactions. Then the most reliable test is the elimination of diet test. The patient omits the suspected food each day and records signs and symptoms in a diary. With appropriate days of recording, we may come to a conclusion that eliminating particular food may help in eliminating symptoms of creating allergy, so that we can come to a conclusion that the particular food is allergic to or is antigen creating allergy to the patient. This is appropriate for children who are generally allergic to milk, wheat. This is only suitable for the patient who are hospitalized, in which we can have selected food which been given to them. It is very complicated and difficult in adults who eat a variety of food, in which it is very difficult to identify which food they are eating or not eating. So it is suitable for the patient who are hospitalized. Testing, first thing, skin test, and in that we are going to see about, there are many tests. First we are going to see about intradermal test. In this test, the extract of the suspected food is packed into the skin over the arm and looked for allergic reaction, whether it is creating any allergic reaction to the patients or not. Then patch test, it is almost similar to the intradermal test. In this test, the suspected antigen is applied to the piece of filter paper over the skin and attached with the cello tape and kept and left for over 24 hours. Red inflammation or hive like wheal confirms the allergy. If there is any reactions like inflammation or anything, we can confirm that the suspected food is allergic to the patient. Then comes the radio allergo-absorbent test, which is collectively called as radio allergosorbent test. It is a skin prick test. It aims at detecting the presence of immunoglobulin E antibodies, measuring the binding of antibodies to allergens such as milk, egg or fish. The theory behind this is, whenever the patient who is allergic to milk, egg or fish or anything else will be creating the antibody G to, the immunoglobulin E will be getting binding with the allergic substance to get rid of the substance. So based on this theory, the measurement of immunoglobulin E is done to measure the rate of allergy occurred in the body. So arbitrary score from 0 to 4 is given, and based on that, if the score level is above 2, then the allergy is confirmed. Comes X-ray, which is a normal X-ray done immediately after the ingestion of suspected food mixed with the barium sulfate is given to the patient, and then the X-ray of GA is taken. This reveals the changes associated with the smooth muscle in the GI tract, which confirms the allergy to the patient, but it is again dangerous, and it may show the distress only after taking the food, which end up in causing dangerous to the patient. Then comes the basophil histamine release assay. It is again the theory of hemoglobin measurement. It is another test again based on the theory of immunoglobulin E. So measurement of histamine is done in the basophils, which is exposed to food antigen. It can be used to test the immunoglobulin E mediated allergy, but it does not provide more additional information beyond the standard skin testing methods. So it is kind of it can say whether the patient is allergic to the particular food or not. It cannot tell anything else than that. and then this is all about food sensitivity. So we have seen about the food sensitivity definition and the symptoms and diagnosis method for food allergy. Thank you all for the listening and thank you for the time spared. Thank you one and all again.